Welcome to day 2 of CRDCN's 25th anniversary conference. The plenary today is data management and supporting fairly restricted data. Before I turn the microphone over to our moderator, Natalie Harrower, I'll say a few words about Natalie. Other than Natalie being my boss, Natalie has been the executive director for CRDCN for 2 years. Before she came to us, she was at the Digital Repository of Ireland from 2015 to 2022. Natalie's very involved in a number of committees, advisory groups, those kinds of things. I'll just mention a few. So she is on the National Research Data Framework Advisory Panel in the Office of the Chief Science Advisor. So Mona Niemer was here yesterday. I think many of you saw that opening plenary. Natalie's also on the Data Working Group for CFI. Most recently, I think the new groups, one of the most recent new groups, is the Canadian Council of Academies Expert Panel on Enhancing Canada's National Research Infrastructure. She's also on the Canadian National Committee for CODATA. So Natalie's been really involved in the research data ecosystem for decades. And she's here today, though, really to share some of her insight and moderate this panel related to policy and implementation on open science practices in the research ecosystem, working with fair data, open science, that sort of thing. And Natalie will say a little bit more about the perspective she brings to open science and fair data, and she will moderate our panel and introduce our speakers. So without further ado, I will hand the mic to Natalie.
Thanks, Joanne. Okay, so good morning, everybody. Welcome back. I'm not going to say too much about, I'm not going to dig into the details because our panel here are the experts on this topic and they'll be the ones that share it. But what I do want to do is just give a bit of context for the panel itself and for the topic, because for those of us that have sort of, I don't know, drunk the Kool-Aid of FAIR, we know what these principles mean and we deal with them all the time and are very familiar. But I know that's not a familiarity that's shared across the board. So I'm curious to see a show of hands of anyone who has ever heard the term FAIR as an acronym before in the room. Okay, so some haven't. And then those of you that think, yeah, I know what that thing's about. I could probably name 1 or 2 of the sub-principles. Okay, good. All right, I'll go into it a little bit then. Okay. So what this panel is about is, first off, it's a kickoff to a year-long project that we're doing at CRDCN, being led by the research team, by Joanne and Grant and Tess, who are here in the front row. And it's called Opening Doors to Data, Restricted Data Discovery and Access. And basically this team is going around the country to all 10 provincial capitals and giving training on fair data principles in relation to dealing with restricted data. Often people think that fair means open. I'm going to talk about that a little bit more specifically in a minute. It doesn't necessarily mean that. And of course, when you're working in a context of sensitive and restrictive data, that is openness is not necessarily the thing that you're going towards. So how do you actually move towards fairness with your data if you're in that environment? So the training will be around research data management and the FAIR principles. This supports a number of different things, but research replication or replication packages are being requested by journals increasingly. So it's how do we get to that kind of state of things in our research? What can researchers do and what resources are available for that? So at CRDCN, we are looking to support progress towards open science practices, towards an open science environment, and find all of the ways that we can do that to support you as researchers in it. So that's the context for why we wanted to have the panel today. Here is the deepest I'm going to go in terms of a definition of the FAIR principles, because there are a number of principles that fall under these letters, but it is an acronym. So it stands for data that is findable. Can you actually find that data, even if you have a link, or is it buried somewhere that's too difficult? Is it accessible? Once you know that it's out there, is it possible to actually gain access to it? Even if there are different hoops that you have to jump through, and we were familiar with some of those in the RDC system in order to get access, are the data interoperable? So do they follow standards that mean you could compare those data sets to other ones in some kind of way that's useful? And are the data made reusable? And this generally has to do with documentation and understanding the meaning behind it and where it came from and that sort of thing. Okay, so where do these things come from? The FAIR principles are around 10 years old. There was discussion before this, but there's a paper by Wilkinson et al. Called The FAIR Guiding Principles for Scientific Data Management and Stewardship, which outlines the principles. So this happened at a workshop in Leiden, and then was very quickly adopted, you could say globally, but I would say in Europe, Australia, UK, sort of advanced more quickly in some of these areas, and as part of a broader movement towards open science to make the processes and outputs of research more open, transparent, and accessible. So you hear discussions around open access papers in journals. That's also under the umbrella of open science, and really probably the first thing that was really focused on in this area. FAIR is widely accepted as a best practice when it comes to approaching research data management. And there are a number of reasons behind this. I talk about transparency, but this was really clear in yesterday's opening panel that we really need to consider data as a major asset. We all need it, we use it. A lot of what we're doing is running on it. Data are used to solve complex issues, and we need good data that's structured well in order to feed large language models so that what you get out of AI is not full of terrible hallucinations, right? So someone has said AI in terms of LLMs is about garbage in, garbage out. So you want good things to be going in. So there's a really significant investment to collect data. The return on investment to that collection and to all of that work that all of our StatCan colleagues are doing to be able to make this RDC system run, the return on investment is then how well can it be used, and is it being used well? Sorry, I always flip. I find data difficult in terms of singular and plural. Okay. Yeah. And we have some data librarians who have very strong opinions that they're not afraid to share on that topic. You can have a whole minute on that if you want. Anyway, so this is something I wanted to, when we were putting this panel together, we said, this is one thing that I should talk about to set the context, which is that fair and open should not be conflated. I think they often have been. Data can still be made more fair, and fair is a matter of degrees. It's not a black and white thing, even if it is restricted. Okay, so both of these concepts, fair and open, should be considered in terms of degrees or on a spectrum. And the other thing I want to say is that fair applies to data, but it also applies to other research outputs, such as code, models. In different disciplines, there's practice-based research outputs and that sort of thing. So it's really about fair research outputs, I think, even though the original discussion started around data sets. And research infrastructures, which was, again, the topic of yesterday's plenary, provide really crucial supports to fair practices throughout the research data lifecycle. So data has to be stored, it has to be managed, documented, archived, preserved, taken out and reused again. And FAIR helps all of those processes along the way. Oh, I'm done. Great. So that was my intro to set the scene, and I'm going to pass it on, and each of our speakers will actually just introduce themselves, and then we'll have some time for questions at the end. Thank you.
Thanks, Natalie. Natalie spoke to some of my slides, so I have more time now, and I didn't know if it was wise having me kick off because I can be a little verbose with this stuff. But my grandfather was an auctioneer, so I'm going to try to put some of those skills maybe to test. So my name is James Doiron. I'm the Research Data Management Strategies Director at the University of Alberta Library, and I'm the Academic Director of our University of Alberta RDC, and I'm very fortunate to also be a current board member of the CRDCN. So I work with folks here in the room across all the good things we're doing. Just jumping in, Natalie's spoken to a few of the points, so I'm not going to go verbatim over my slides, but I cut my teeth in health research. So I'm based at a library, but I moved in there in 2016. I thought I knew what librarians did. I had no idea when I got there, and that they did all sorts of things that I benefit from, and I'm surrounded by people smarter than me at most things. But I brought over my applied health research experience, my applied social sciences research, and those have really translated into the pathway that I found. And the pathway did find me. I didn't go to school thinking obviously I was going to do RDM because there's no degrees in it, but the path found me, and I think I'm exactly where I'm supposed to be. But I'd always worked with restricted data to whatever that meant, whatever degrees. And I really recognize that they're very unique sources of information for our research. Often you can't get that information elsewhere, whether that's because there's a specific topic of focus or there's specific variables that are available via that restricted pathway or level of aggregation or demographics and so forth. And many of you are very familiar with this, I'm quite sure. And then once you get into things like linked data, you know, your risk levels increase, and it's much tougher to work through. And going back to my earlier days, that was even, you know, a tougher go for most of the times. And often you get the data and you can't really work with it. You can't understand it. Maybe it's because the metadata is not there, or for all sorts of reasons, it's not openly discoverable. And if it is discoverable, how's the pathway to it? Is there even an easy enough pathway to get to it? Lots of restrictiveness in terms of licensing, and then the usage parameters. How can I publish on it? To what level can I publish? What can I do with my outputs? Again, I'm seeing nodding of heads. I think, you know, preaching to the choir a little bit. But of course, we've got a very different landscape today as well, certainly from when I started out 20-ish years ago, where, you know, the start of the talks around open data, we're starting from the journals and starting to think about, you know, keeping our data, retaining the data, not pick up a rotary telephone and call the researcher and hope that they answer, and do you have the data? And maybe they do, maybe it's on a stick, or maybe they don't, you know, those types of things. And now as we move forward with even having to do requirements at the funding opportunity levels, and very notably the Tri-Agency's RDM policy they released in 2021 that speaks to a few pillars, including around data deposit and thinking about long-term data stewardship. So I wanted to just kind of take the fair, and I know Natalie spoke to a bit, and just kind of unpack it a little bit here by each of them, what they mean. So I'll let you, you know, read those, but I think about, again, my background, my aha moments, and I can trace them back to, you know, my experience getting into research and starting with my undergrad at Queen's University. I was involved in a large multidisciplinary research consortium called ASD-CARC, Autism Spectrum Disorder, Canadian American Research Consortium. We had over 3,400 families, I think, at that time, contributing all sorts of information. Our PI was geneticists. We had genetic samples coming in. We had dysmorphology folks. We had epidemiology. I was involved in the psychology part of things, doing perspective studies and tracking children's as they grew, and if they had one or more siblings in their family with a diagnosis, and trying to build up normative databases. There was just a ton of data coming in. And I knew now, if I look backwards, that we weren't fair, right? We weren't doing it in a fair way. It was a different time. And if we were to go back and try to find those data now, if we try to use some of those data, and this isn't a finger wag, this was the norm, right? So it's kind of, as I look back at that, I said, well, you know, we can do better, and I want to do better. I want to learn from those lessons and move it forward. I got to know a lot of those families really well because of the study I was doing, and they did not have extra time to give, but they were giving of that time, and they were doing because they had invested, they were invested in the research. They wanted to, you know, they knew they wouldn't immediately perhaps benefit, but somebody else would down the road. Then going into my graduate studies, I was doing my master's degree at the Center of Criminology at University of Toronto, and unfortunately, a young boy in junior high, middle school, had been shot and killed in public school property, and there was a big inquiry. Jordan Manners was his name. There's a big inquiry, and I became involved in helping to inform some policies, you know, level writing with professors around the roots of youth violence, and I was doing lots of literature searches and doing the writing, and I really got frustrated when I tried to get access to some of the data, because the data wasn't there and they hadn't been retained, and there wasn't repositories, and I couldn't get to it. And that was, again, another one of those aha moments where I just went, you know, I think we should have a higher bar set here around these things and be able to go and find those pathways and be able to access the data. Maybe it's for repurposing, maybe it's for replication, whatever the case might be. Moving forward into my health career, research career at University of Alberta, I became involved in a large pan-Canadian research program called the Translating Research in Elder Care, and it was looking at the long-term care sector. We collected over 4,000 surveys in those 5 years I was there. 3,000 of those were one-on-one interviews with healthcare aides, so you can imagine the amount of effort and time and energy you're putting to those. But the real one was collecting the longitudinal data on residents that are in the health in the long-term care facilities, and we had 36 facilities across 3 provinces. And if you're doing that, I think it was between 2007 and 2012, so it's a lot of data. I remember getting the MDSRI data, and some of that is actually available in the RDCs now through the CCRS, through CIHI. I remember getting CDs and not being able to open them. I remember getting them and not being able to understand the data at all because we couldn't use CIHI's data. They were only going down to the care facility level, and the premise of our study was actually that things matter at the long-term care unit level. So we needed to go out and we needed to collect that data from across provinces, from across health ministries, from sometimes private vendors because they were doing the collection for the homes. And I also remember the first data that we got, and it was me driving down Highway 2, 300 kilometers to Calgary to pick up a CD. And that was the findable. That was accessible, but I don't think that's what we meant by fair. I could find it 300 kilometers and access it. I remember Carol Eskerbrook, she was the researcher I work with and still do today, said, and when you get that CD, you tape it to the spare tire in the trunk with duct tape. So if you get hit on the highway and you cease to exist, I'm like, yes, the data will be there. I understand. I love you too, Carol. So these are all just, the things. And so when I got involved at the RDC, it was a no-brainer. I could talk, forever about all the, other lessons and learn. But really, it's just, it really is important. And we are in a different time today. Some of those, I guess that was for the folks that are a bit, younger and earlier career. That was back in my day, I had to walk 10 miles uphill both ways to school. There was a worse time. So as bad as it seems today, it's the good work we're doing is making a difference. And then I just want to chime in. I'm going to speak really quickly. One of my other hats I wear is as co-chair of the Digital Research Alliance of Canada's Data Management Planning Expert Group. I've been on that group for a decade or so and chairing it, I think, for 7 years. Kevin and I were just talking about that. He's like, when are you going to do your exit? And it's something that has really taken off, and in part as well, going back to the funder requirements, and notably the tri-agencies, the RDM policy they released in 2021. Pillar 2 of that is starting at the funding opportunity level. Certain funding opportunities, and this will increase, will require a data management plan at the time of application, right? Painless if you say it fast enough. And I am of the mind that researchers' most valuable currency is their time. And if we are going to get them to do things that are going to add burden, we need to try to help them to understand why that time is important, what the benefits are. And I'm not going to drop the mic, don't worry, but not just drop the mic and walk away, to help them to do these things. So data management plans, they're formal documents that will help for hopefully people to effectively manage their data. I am of the mind that you don't have to have all the answers at the front end. Even just asking the questions sometimes is starting to manage your data. Sometimes folks don't know the questions to ask as well. So providing good templates for research data management plans is important, and those have 2 real big components. Number 1, the questions they're being asked, making sure you're asking the right questions. If you don't have the answer, you can bookmark it. You can go, look for that answer, reach out to the expertise and such. The other part is the guidance that comes along with those questions. So here's a question, but also here's ways to help you and guide and support. And these are evolving. These are very much evolving as we go. So this is just a visual of some of the key categories you might see in a data management plan, and the types of things that folks will talk about, and how this ties into fair is that you're more likely to have fair data if you're thinking about things at the head of time. If you're thinking about, and let's say you're doing human participant research and you need to have participant consent and you need to have things right in your ethics so that you can do the long-term data stewardship, whether that's so that you can go work with the data yourselves, again, outside of the primary research project or not, right? So there's lots and lots you can do. And also as providers of data, creating good templates that can guide the researchers as well, making sure so that you know what you're supposed to be thinking about so that you can find that pathway to fair. And so I just want to do a shameless plug about the DMP Assistant. It's operated by the Digital Research Alliance of Canada. We've hosted it at U of A Library for about a decade now, and tomorrow it's migrating to a national infrastructure, the Arbutus Cloud at the University of Victoria. So far, the last 3 migrations on other platforms have been done when I'm not there, and they've worked out. So I think that's the lucky charm. I'm not there, and hopefully this thing will work out. And then I really want to, and there's a link there for you to go access. I'm happy to talk about that afterwards as well. And I just really want to highlight 2 templates that are available through the Data Management Plan Assistant, and they are specific to the CRDCN. The credit goes to Grant Gibson here in the front, who took the big heavy lift on writing them. I understand he'll be doing an autograph session at lunch over with these, so bring your DMPs. But they really tie into 2 things. First is accessing data from the research data centers, and the second is about external analysis. And they're ready, I think, probably soon to be updated once VRDC comes in. Fantastic, but hopefully this is something that will be acting as a good resource for you and provide you that framework and that pathway for the work that you're doing in the RDCs to also not just support your research, but to get you on the pathway to that fair.
Good morning, everyone. So My name is Kevin Read, and I'm a faculty member at the University of Saskatchewan. I'm an associate librarian for research data management and open science. I'm also the chair of the Digital Research Alliance of Canada's Discovery and Metadata Expert Group, and I have been for about 6 years, as sort of Grant or as James alluded to. I think I'm here, and thanks for the organizers for having me, because the bulk of my research has really focused on the discovery and access of restricted data. So after I finished grad school at UBC, I actually went to the States and worked at the NIH and NYU School of Medicine for about a decade, where my entire role was looking at how to make health sciences restricted data more findable, more accessible, and create pathways to doing so. And so today I'm going to talk a lot about, since I've come back to Canada in 2019, I've been looking at this in a Canadian context to figure out what are the challenges associated, with finding and accessing restricted data in a Canadian context. Some of this work has been done with some collaborators through the Alliance, as well as through other collaborators I've worked with, one of them being Grant Gibson here in the front row. Another is actually the academic director of the CRDCN at USass, Sarah Rutley. So lots of integration in the Canadian context of doing this kind of work. As I talk about this, I want to make a distinction. The first part of my research has focused on restricted research data generated by researchers. And the second part is looking at data sources that have restricted data that they make available for research purposes. So that distinction is important to know just because of the findings that we have here. So hopefully this will spur some ideas in your head and we can have a good conversation about it afterwards. So to start off with restricted data, normally when I think of restricted data, I maybe unfortunately think of data availability statements like this. So you read a paper, you think it's fascinating, you're interested in the data, you're curious about how they analyzed it, and then you go to look at how to access that data and you get a statement like this saying that the data is currently available from the corresponding author upon reasonable requests. Well, what does reasonable mean? What does that look like? What would I have to actually do to fulfill a request in order to get access to this data? And so in 2021, I ran a study where we looked at all CIHR funded publications that were ever created that indicated that they had shared data in some way. And we found that 33% of those shared data by request, by reasonable request, or by application. And this makes sense, right? It's health sciences data, it's sensitive, it makes sense that some kind of request would be required in order to access some of these data. The issue was that not a single publication provided any detail about how to access it, what data was actually included in this process. And because of that, it creates a lot of uncertainty in terms of what data exists here. Who am I even eligible to access a request? How long would it take me to make a request for this data? And this is one of the challenges from the FAIR perspective is right now you could describe this potentially as findable, but I actually don't know what it is or how I would go about accessing it at all. This is also reflected in the literature when we think about common challenges with restricted research data. The most common one being poor and absent metadata. Metadata about the data sets themselves, but also transparency about the access request process. What does someone actually have to do to fill a request like this? In a Canadian context, we currently don't necessarily have suitable infrastructure for an individual researcher to share restricted data in a repository, for example, because it's still only accommodating public data sets. This is changing a bit because I know groups who are working with Borealis, a common data repository in Canada, are trying to accommodate restricted data, and the Controlled Access Management Project through the Digital Research Alliance of Canada is making attempts to do this. But right now, there is no way to provide a storage place to make restricted data discoverable in a national system. We also know the data available upon request problem is pretty prevalent, and you can look at many different examples of this. There was a study that basically tried to get requests from a 5-year span of publications that said available upon request, and only 11% granted access entirely. Another study more recently said that basically data available upon request, that availability decays at a rate of 6% per year. So if someone was to publish something in 2019, the likelihood of you getting it would be 30% less than it was 5 years before. And then when it comes to institutional support in Canada for restricted research data, one study looked at national institutional strategies for RDM to see, in compliance with the tri-agency policy, what they mentioned and what commonalities came up when they described providing support for the researchers at local institutions. And only 2% mentioned support for restricted data. That's not to say that they're not providing support in that area, but only 2 of them mentioned it as a priority. So lots of potential opportunities here for building an infrastructure, metadata, and support and training, which I know Alex is going to talk about next, which is a really important thing to think about for making data fair, especially if it's restricted. So Okay.
Yeah. There you go.
Thank you so much. Okay, so let's pivot to looking at restricted data sources that can be used for research purposes. So last year we published a study where we tried to find every restricted data source in Canada we could possibly find. And we isolated our sample to health sciences sources, so about 48 sources in total, and essentially evaluated how well they made their data discoverable and accessible. And in terms of the impacts on FAIR, this is what we found. Almost 80% had no use of metadata standards whatsoever, meaning that none of this data would actually be discoverable in national aggregators or even in a search engine of any kind. There was an inability to explore or discover data sets through searching and browsing 70% of the time. There was a lack of data documentation to support the interpretability and reuse of that data, over 50%. And we generally found opaque data access restrictions, meaning we had no idea, or these data sources did not provide any indication as to who would be eligible to access these data sets, which again creates a huge burden on the researcher for determining whether they invest the time to make an application. So if we look at data sources in a Canadian context that are making their data available for research purposes, that data is currently extremely difficult to find, even harder to access. And if you finally get to that stage where you can access it, it might not be usable. And so this is another huge opportunity for us to explore how we improve FAIR for restricted data. These are all areas we can focus on. And so we actually took this a step further and we looked at asking a few more questions around metadata. So we said, maybe do these restricted data sources describe their data sets and their access procedures in similar ways? And what we ended up finding was we looked across all 48 to see, are they providing similar kinds of information? And in fact, in most cases, they do. They are describing their data in common ways, and they're describing the access procedures in similar ways. What we then did was see, okay, let's see what these descriptions are, and can we map them to existing metadata standards? So dataset standards like DataCite or the Data Documentation Initiative have robust metadata infrastructure to describe datasets, and we found that they actually align quite well. So there's a huge opportunity for these data sources to already be indexed on the dataset side to make them more discoverable. And I know this is actually happening with the CRDCN right now, working with Lunaris, our national discovery infrastructure, to make CRDCN data more discoverable. The challenge was that metadata schemas that we looked at had no level of detail about the access process whatsoever. So most times when you're looking at metadata from an access procedure perspective, it's a full text field that requires a data steward to describe what that access process looks like. And so without structure, people aren't thinking about maybe what are the necessities that someone would need to know to make access to this data. And so if we actually want to make the access process more transparent, metadata systems and schemas will need to adjust in order to accommodate these things. So right now, because of that, there is no mechanism for researchers or restricted data sources to provide structured information about the access request process. It's simply based on knowledge and their will to provide that information as a whole. And so with that, I think there's an opportunity here to think about metadata, about infrastructure and support, both for data sources and the data stewards who provide data through that mechanism, as well as individual researchers across Canada to improve this aspect as well. And so one of the things that's important in that process is training, and that's what I'm going to pass it over to Alex to do. So thanks so much.
Thanks, Kevin. So I'm Alexandra Cooper. I am the Data Services Coordinator at Queen's University. And as Data Services Coordinator, I'm kind of on the other side of like the RDCs. I don't actually work with RDC data. I work a little bit with our analyst. If a researcher comes and asks a question, I'm like, oh, you want to go to the RDC? Let me show you the way. So I support faculty, staff, students, anyone in the Queen's community who is looking for data, but it's public use data. So public use microdata files from StatCan, helping the StatCan website, governmental, any kind of governmental data, but it's all sort of the public use or lightly restricted data. And then the other part of my job is research data management and helping the same group of people with how to work your way through the research data lifecycle from right from the beginning when you have your first thought, what do I do? Well, you start writing it down and start documenting and then create a DMP, applying for ethics, all the way through to depositing in some sort of repository like Borealis or disciplinary repositories. So that's what I do. When we first met the first time and started talking about this plenary and what each of us were going to cover, I was trying to figure out, like, how do I fit within this plenary? I don't work with a lot of restricted data. I don't work with a lot with the RDCs, that sort of thing. So where is my place in this? And as I was listening to all of these people talk, I was like, well, okay, this is really interesting and fair. Yes, we have to be fair. We have to make this open data that is not necessarily data that's available. Maybe it's methodology and that kind of thing, and codes so someone can replicate. But how do people know how to do this? So it's the training. You have to go right back to the very beginning of the training, and that's kind of where in my position, I do a lot of that. People come, I talk to a lot of first year grad students. And I always say when I meet with researchers, tell a friend, this is what we do in the library. We support this, and we'll come and talk to you one-on-one. We'll talk at groups, we'll talk to faculty meetings, we'll talk to your classes, we'll talk to anyone who will listen about how to do this. And that's really where making data fair starts. And it starts really with the undergrads and the beginning grad students, because they're the ones that are going to be the researchers years later. And if you can get that into them doing the research at the very beginning, it just becomes part of the research. And it's not a big deal that you need to create code books, you need to write the metadata, you need to understand what the metadata is, and what's the importance of keywords. What's the importance of having a good description of what the data set is? It's all there, it's just part of the work. Yeah, and metadata, a big piece, oh, hold on, I do have slides here. There we go. A big part of FAIR is the metadata, is the proper description, is making sure everything's listed so that when someone's doing a search, they can find it. But it's right down to the variable level. So when I'm working with researchers and they're like, oh, that's a lot of work. Yeah, it's a lot of work because you didn't come see me at the beginning, and I could have told you this at the beginning. But it means metrics, it means citations, it means that the stuff is going to get out there and people will use it. And when you start at the very beginning, every time I say that, I think of The Sound of Music. And I want to sing, that's how it is. That's how it starts. It starts at the very beginning. You understand what metadata is, and it's not this foreign concept. Keywords are not a foreign concept, topic classifications and things like that. And understanding requirements for depositing and what the journals or funding agencies want. It all makes sense if you know how to do it properly. So one of my big things when I'm talking to researchers is, in 5 years, are you going to be able to answer the question of why did you code that variable that way? Or why did you ask that question? And the answer is generally no. So when you're depositing data, you want to make sure that you're answering all the possible questions that could be asked of your data from someone else. You don't know what those questions are, but you want to be able to answer them so that nobody contacts you and says, what does this mean? So I wanted to just sort of end off with a couple of examples. Training is a big thing in the Digital Research Alliance of Canada. The research data management stream or pillar, or I'm not sure what that's called anymore, which Kevin and James and I are quite heavily involved in. That's a lot of what all the expert groups do. I'm a member of the RIG, the Research Intelligence Expert Group. You wouldn't think that I'd been a member for a very long time and was formerly the chair. But that's one of the things we work on, is creating this training, making sure that across the country, everybody has access to this sort of stuff. So this RDM Jumpstart course is happening actually as we speak, literally. And it's a group of people got funding for this from the Digital Research Alliance of Canada to hold this week-long course for grad students to learn about RDM, explore issues, writing metadata, using R in everything you need to do. And they had, I'm not sure if these numbers are correct, but as far as I know, they had like over 100 applicants for 30 spots. So this is something that's wanted. It also helps that probably all of us, like people like Kevin, James, and I in all the libraries across Canada, like mass emailed all of our professors and said, get your students into this. But this is one good example of it shows the need for this kind of training. People really need to know this because they're hearing, when the RDM tri-agency policy first was announced, here's the draft version, all of our researchers were like, yeah, okay, well, tell me about it when it's a policy, when it's going to affect me. And then it came out and we're like, this is going to affect you now because you have to have a DMP. And they're like, oh, what's a DMP? So now people are being more aware of this. They're like, well, how do I do this? So we're getting a lot more of, I've been told my journal won't accept my data. My funder says they want this. So this is all the training, and why I think we've had a lot of response to this kind of course is that it's out there now, it's much more known. And then the other one is a project that Kevin did. I feel kind of weird talking about this, this is Kevin's thing, but so a couple of years ago, he and Sarah Rutley introduced this course where it was about data management plans and making sure teaching research assistant students who were working with faculty over the summer, that they knew how to write a data management plan and how it all worked. And the first link will go to the actual program, and they've expanded it. And then this DOI goes to an article about how they implemented this first course that they did. And it's an excellent article about how you can implement RDM training within a very simple thing of training students who are working for the summer on DMPs, on DMPs. So I think that's it for me.
So good morning, everyone. My name is Ted McDonald. I'm director of New Brunswick Institute for Research Data and Training, which is our provincial administrative research data center. I'm also on the board of CRDCN, and I'm on the executive of Health Data Research Network Canada. I'm also the academic lead for the Maritime Sports Support Unit. So I wear a lot of hats. New Brunswick's a small province. There aren't very many of us. I end up doing a lot of these. But what I'm going to focus on in my talk is on administrative data, making administrative data fair. And where a lot of this comes from is my personal experience of being tortured by the Department of Health and Department of Education in New Brunswick for 15 years. So this is sort of like my grievance list. But this is why it's so hard to have administrative data be fair. And so I just want to start by, first I want to talk about what is administrative data. Are most people familiar with the term administrative data? If you've used the RDC and you've used tax data or immigration data. So basically administrative data are data that are collected by government in the provision, delivery of government services like health or education, or in the administration of programs like tax, income support, and so on. And these, as we know as researchers, these have enormous research value. But they're also very different from surveys and things like that. And here's my first slide is, why isn't it easy to make administrative data fair? Why is it so hard to get access to administrative data in a usable way that allows me to do research quickly and turn things around? Well, the first one is that administrative data, person level administrative data, requires legislative approval for everything. It's covered under legislation. The authority to collect, to store, to access administrative data is covered by legislation. So you need an authority to be able to access the data. It's not open access. And the second point is that legislation by construction is general. It doesn't say exactly how you want to do this. So even if there is a legislative pathway for research, there needs to be a process to actually operationalize that complies with legislation. And in that, designing that process, oftentimes, if there already is one that government has put in, it is far from easy, cheap, or efficient. And it can also be the source of great frustration for researchers who've tried to get data directly from a government department, even when the legal authority is there through legislation to say, there is a pathway to get data for research. So the design of these pathways was not done with the FAIR principles in mind. The third thing, and my colleagues have addressed some of this, is the design of some of these data systems, like the data system to capture information when you visit your physician. The system is designed to ensure that the physician is paid. That information is rock solid, but everything else about the visit is shaky. There is no consistency in systems. The systems were designed for a particular purpose. And when you want to say, well, what about, can I get this for research? They say, well, it's all free text and you can't have it because there are privacy issues. And there's very limited use of common data models because the systems are kind of bespoke. And I'm talking about historically, and later on, I'll talk about some progress there. So this is the next challenge. And the third one, this was definitely mentioned, there's no documentation oftentimes. So we have data sets, we get data sets into a provincial administrative data center, and all we get is an Excel spreadsheet, and it just has a list of kind of coded variable names. We say, well, what are these? And they say, well, the guy who knew that what they were is left. We don't even know what's in that data set because no one's ever asked for it before. So data documentation is limited, incomplete, or non-existent. So this is kind of our starting point. This is historically the way things are. Before I want to move on, here's another reason why making data fairer, administrative data fairer, are more complicated. So this very easy to follow diagram is the New Brunswick health system. And you've got hospitals administering services, you've got clinics doing lab work, you've got clinics administering, say, diabetic foot care. There's a whole bunch of these things. The hospital data is pretty good through the discharge abstracts, and that's the role of CIHI. But clinics have their own EMR. Sometimes it's paper-based. They don't talk to each other. They're in local systems. Some of that data goes up to a regional health authority. We have 2 in New Brunswick. There are labs and imaging and screening. Some of those results go to the RHA. Some of them stay in local servers. Some of this goes to the Department of Health, where they're trying to build an electronic health record, which is basically try and pull together all of my health information just for my improved care, so that when I go from doctor to doctor or hospital to hospital, I've got those records because the system is not sending them. Then you've got physicians using their electronic medical records. There's some data going back and forth. There's a patient portal, which I'll talk about. Then you've got genomic data off to the side and wearable data off to the side. And those dotted lines and lines going back and forth, it's all partial data moving oftentimes without much documentation. It's often designed just to serve the purpose of meeting the need of the patient. This is health. This is the most advanced. This is the most advanced in terms of making data accessible with common data models. When you think about justice data, social development data, education data, environment data, they are not nearly as developed as those. So that's another thing that's very, very complicated to negotiate. Given that's the system, what can we do as research organizations to make data fairer? And this is where, okay, we're going to just accept that we can't change the system, but when we get the data, maybe we can do something with it to make it easier for researchers to get access. The first thing is there can be enabling legislation, which you need to say, okay, I'm going to make you a data custodian. So Statistics Act and Statistics Canada and how it works with CRDCN is an excellent example of taking complex data, putting them into a system where researchers have ready access to them with some pretty good documentation, metadata, data standards, data checking, missing data, all those things. This is one of the roles of StatCan and the research, the CRDCN. In the provincial, and this is I know I've been I've been the academic director. I think I'm the longest served academic director in the whole network. It's been 21 years. They have to suppress my record because of small cell counts when they're reporting stats. You can have prescribed entity status, which defines an entity such as ICES in Ontario to say, you have the authority, we're going to give you all the data, and then you deliver it to researchers to support, and you worry about all of that. Also in New Brunswick, we have the Act Respecting Research, which is my institute, MBRDT, which makes us a data custodian. With that authority, then we can get all these metadata from multiple sources, and we can make it fairer. So the government is downloading these functions to our organizations. And what the advantage of this is that as a research organization, we can define a pathway that is specifically aimed at getting research better data faster, cheaper, and more efficiently, because that's our purpose. We can work on better and clearer documentation. Often it means calling back to Department of Health and saying, do you know anyone who can answer why this series has a break in it and the variable name changes? They say, no, we don't know that. So sometimes it doesn't work so well. We can work on common data models and algorithms. So working through Health Data Research Network Canada, where the data we're getting from our provinces is all over the place, we can implement common data models to make it easier for researchers to do multi-jurisdictional research. And we can have a commitment to publishing results. That everything that we do in New Brunswick, it goes on our website. The data, we have a lot, we're working on metadata, we're working on code books, we're working on common data models to make it easier for us to be part of multi-jurisdictional studies. But that's what I call retrofitting data. This is what we're doing after we get the mess from the department. So I want to end on a sort of more positive note for my government colleagues. There has been lots of progress more recently in government data systems. They are evolving pretty well. And I've got some acronyms there: One Patient, One Record, Electronic Health Record, EMR. There's a lot of centralization of data, a lot of common data sets, a lot of work that goes into making data easier for clinicians to access. And I have a little app there. So My Health NB is an app on my phone. I can see my blood work. I can see my blood work almost the next day before the physician sees it. I can see my labs. I can see my prescriptions. I can see my imaging results. That's fantastic for patient care, for enabling a patient to be part of their own care. However, when we asked about, can we get the EHR with all this really valuable clinical information into our center, they said, no, the EHR is designed specifically not to allow research. Like, well, why? And so there is lots of evolution of systems, but it's still not reflecting the fact that there is an enormous value to secondary use. So where I'm going to end, and before I think Amy might cure Joanne to put the hook on me because she was pretty scary yesterday in one of the afternoon sessions. What can we do? What can we do? We have to address where the government is, where the data is collected at source. We have to make the business case that is worth it for them, not just to serve the research community, but to serve their own needs. So I'm going to mention three things very quickly. One, we can demonstrate that making data fairer at collection improves efficiency for government. It makes it easier for them to do their work. It can reduce costs. So some of you may be familiar with the Canadian Chronic Disease Surveillance System. Every province has to report up using common data algorithms to CIHI. New Brunswick hasn't done it for 4 years because they cannot get organized to figure out what the last guy did in his algorithm to report diabetes. So doing this meaningfully can reduce costs. And the final one, we can demonstrate the value to government of doing this to government. We can demonstrate that if you make your data fairer, it makes our lives easier. We can link data over time and we can across data systems, and we can do multi-jurisdictional research. We can compare across jurisdictions, and we can help you, government, evaluate your programs and look at the impact of your programs. So we have, as researchers, we have to continually make the case that it is worth it for the government collecting the data that has so much value to do it in a way that's fair because it's going to benefit them. So that's it for me. Thanks.
I love that you ended on such a positive, almost call to revolutionary note. Yeah, after starting with the fact that you've been tortured on this topic for 15 years. So there is hope if there's hope. Yeah, exactly. Yeah. Have a little more coffee there. If Ted can end on that note, then I think we're all in good shape. Something I found really interesting is that when I think it was when someone said, oh, the guy who knew that variable has left, right? Everyone like smiled through painful gritted teeth and nodded in the room. So there was that. And then also something Kevin said is that when you did your analysis, you found out that actually a lot of the data sets were using similar kinds of ways to describe things. So what I think, these are two really good indications that the elements of FAIR are already happening in certain ways, or we're already aware of the pieces that are missing. There isn't anything particularly new about the concept of FAIR. It's just that it was organized well in a way to put it into an acronym and to find a mechanism to bring us all forward on it. So I think just a couple of observations from what you said. But I think what I'll do for the first question is I'll come back to sort of where Ted was ending. So you were talking about retrofitting and a couple of things that we can do. And I want to open that question about what are some of the things that we can actually do, maybe some easy wins, and ask that of the panelists. But I might start with Alex on this particular question, because you're involved in the training, you're helping researchers. And if they, if you were to say, what's one thing that you could start with? Because it does seem quite overwhelming when you look at all the principles, and if you look at them in detail, it seems like too much. So what is a first step?
The first step is to go to the library and talk to someone. Honestly, it really is, because it is overwhelming. When at the Queen's Library, we really first started with this idea of research data management was back around 2013-ish. And we set up a committee to talk about how were we going to bring this into the library to then get it out to the researchers. And so we had a couple of people. We had someone from the Vice Principal's Research Office, and we had a professor from business. I can't remember exactly what her title was at the time, but she was there because she was like one of the administrators in the business school. And she said to me one day, oh, I have this grad student who's doing this. Can you help them with this? And I said, yeah, sure. I said, but what about your data? And she said, what do you mean? I said, well, you're sending grad students to me to get their data deposited, but what about yours? And she's like, oh, I've been doing this for 30 years. I'm like, yeah, have you like, can anyone get it? And so every time I saw her, I said, you keep saying you're going to come talk to me. And she actually said to someone one day when we were at a conference, anytime I see Alex on the street, I cross the street. Because I kept bugging her about it. And it is very daunting. And I've talked to a lot of researchers, faculty members who are so excited when their grad students get things deposited. At Queen's, we have our thesis repository, which is called QSpace, is separate from our collection, our own collection in Borealis. So grad student will come, they have their thesis going into QSpace, they have their data going into the Queen's Borealis, and we can link them. I send the DOI to the person who runs QSpace. She sends me the handle that comes from QSpace. I add it to the data. So the thesis, any articles, anything, it's always linked. And the professors are like, this is awesome, this is awesome, this is awesome. I'm like, but what about your data? And it's like, that's too much work. Yes, it is a lot of work, but it can be done. And it can be done, I don't like doing this, but it can be done with minimal metadata. So it's not perfect. You may get questions coming back to you, but at least it's there, or it's findable. Or with an example of some census data, it's really restricted down. It's hard to get, but people are aware of it because it's sitting in Borealis and they can find the record. So the first step is come to the library, talk to us, let us see what we can do. Let us see what the quick win is to get it somewhere that someone can find it. That is not, I'll give it to you when I'll try to send it to you. Or I was working on a data set years and years ago, like almost 20 years ago, trying to make it more accessible. And I sent naively an email to the PI, and about a month and a half later, I got a response that says, yeah, I'm way too busy to answer that question. Good luck. And I'm like, okay, well, this is how it's going up. And if anyone asks me questions about it, I'm going to say, here's the PI. Good luck with that.
Okay, so
The
people
quick
should
one
come
is
to
go
you.
the library or to the RDM specialist at your institution.
Okay,
Sorry.
thanks. No, it was good. Kevin, you've got your mic up.
Yeah, well, the easy win part made me laugh a little bit because I've been trying to explore restricted data discovery access for my entire career. And in the library world, open has always sort of been the way. And when I talk about investigating restricted data, people are, it's too hard. It's too big of a challenge to tackle. And so what I think is coming out, especially if I'm speaking to my own research, like one of the things, even though I highlighted, 80% of those data sources didn't have metadata, 70% didn't have any way to search them, 50% didn't have documentation. There were some that did a really excellent job, but they're still not discoverable in national systems. And so one of the things we're actually working on through the Digital Research Alliance of Canada's expert group that I'm on right now is we did prioritize ones that we thought would be really suitable to be more discoverable. And we are engaging with each data steward and custodian at every institution to try to make that data more findable for other people, because we spent a month and a half trying to find these data sources, and we were actively looking for them really, really hard, and still took that long to find them. So the likelihood of someone else coming across it randomly is not possible. So this would actually allow a lot of these Canadian data sources that have valuable data that can be used for research purposes be more discoverable in systems like Lunaris or through Google Dataset Search or through other systems as well. So I think that's at least a small win we could look at. And then I think the other side is the RDM policy, Trident policy, when it comes to people who have restricted data with the new data deposit requirement. How do we be transparent about providing access instructions? I think the data is one thing, but if no one knows how to access it, it's just as challenging. You can see the data there and say, that looks great, but I have no idea what the time investment is. I don't know if it's going to cost me money. How long is it going to take me in alignment with my grant? All of those things I think need to be well documented, and researchers need guidance to do this. And without it, we'll continue to see available upon reasonable request until that changes.
Okay, thanks. Can I see a show of hands who knows what Lunaris is or Borealis or knows those terms? Okay, so there's fairly good recognition, because all of you on the panel have talked about Lunaris, Borealis, DMP Assistant. You're talking about things that have to do with that are being managed by the Digital Research Alliance of Canada. It's been a prominent kind of comment across the panel. Is there anything that, like, what do you think the Alliance is doing in this space? Is there something they need to do better? Does anybody want to address that? No, sorry. That's a terrible question because I don't want it to be a long answer. But it's been mentioned a lot, and I'm not sure if everyone's familiar with what they're doing. So why is that such a core entity?
I can give a real short answer.
Can you?
I can. So Borealis is just a generalist repository. Most Canadian universities and colleges have a space. It's managed by Scholars Portal, which is the service arm of the Ontario Council of University Libraries. It's a national infrastructure. That's the short answer for Borealis. But in terms of what the Alliance is doing, the Alliance is working a lot. We're on expert groups. As I said, we try to create training, we try to create resources. The DMP Assistant was the very first tool created by Portage, which became the Digital Research Alliance of Canada. But this is my thing. The very short answer to this is the government needs to give us money, and the government needs to start funding research data management for the researchers in the funding. So basically, the real simple answer is we need money for more staff and more people to help with this.
Yeah. Go ahead.
Yeah, maybe I'll speak from the Borealis side, because it is a national infrastructure that is installed locally at every institution that supports it. And in my mind, the investment of the big project Borealis should be working on is access pathways to restricted data enclaves in individual institutions, and getting that harmonized and standardized as much as possible. I'm not sure the total number of institutions that have implemented Borealis. USask isn't one of them, but I think to actually have a system that could connect research data stored in a secure environment to metadata that is openly discoverable, that would allow researchers to follow through standardized access pathways depending on the level of sensitivity, would be a massive investment and worth the time.
Okay, thanks. I mean, what I was trying to get at is there's what the researchers can do, right? They can start with data librarians, but what do we need to do at a system level? And I think we could probably talk about that for a long time. I want to circle back to something that came up. We had a lot of discussions around health on the panel. So I just might ask James, you talked about working in with health crisis data and that sort of thing. What are some of the risks or the costs associated with data not being made fair? Like, yes, okay, we've talked about the things you can do that make it not fair, but then what's the risk with that situation?
Yeah, that's a great question. There's a lot of risk with it. And certainly when you think about health research and health data, when you are working in areas that are going to affect both bedside practice and policy, you don't need, necessarily 20 years ago data for some of that, but you do for the long trend and for be able to, so you need to see where you've come from to know where you're going to go, that old saying. And when we don't have the data available, or we don't have it accessible, or we don't have it usable and understandable, we are losing that information, that knowledge, that past, and we can't go in a good way forward. I find is one of the, the things I really think about. I think coming back even a little bit to your first question about what can we do, and I'll do my philosophy. Here we go. Ask ourselves, why is the data restricted? Right? Why is the data restricted? I mean, the we and the royal we, like the RDCs could be, like the organizations, the researchers, you doing your primary research, because there's really good and defensible reasons why data are restricted. Those could span across things like commercial and legal and ethical, but there's also a lot of not as defensible reasons, like it was just too hard, or I just didn't think about it. And that's not a finger wag. That's up to us to support people to understand what you can do, so you can do those pathways and find those, those ways to do it. So thinking about that as well. And we're running into these situations. And again, I've got one right now where a researcher doing a great research, immensely valuable research, and just there was things not done at the front end to allow that long-term data stewardship. And her big thing right now is she's trying to publish in PLOS One. PLOS One wants it open. She can't make it open. Okay, well, now how's our pathway to it? They want an author or a contact outside the author group. We're not set up for that. We're not ready. And so as institutions, we need to do things as well. And so I'll just end that with research data management. And I say that word very broad umbrella, spans across the entire research life cycle. It's a shared responsibility, right? It's the researchers, 100%. Researchers have a responsibility, but so do our research institutions, our research communities, and so do our research funders. And that's the ecosystem we need to do moving forward. And the Alliance comes into play supporting all of that. Is it perfect? No. Are we immensely better off today having the Alliance than we were 20 years ago when I was walking uphill both ways to school in blizzards? 100% yes. Yeah. So,
Ted, thanks, James.
Yeah, it's so in addition to the costs to researchers, it's costly to the system itself. It has impacts for patient care, but even just for the system itself and its normal operation of business, it churns up enormous amounts of time and frustration and resources just to answer basic questions. I'll give you one example. There's a clinic called the Fredericton Downtown Community Health Clinic in Fredericton, New Brunswick. And they work with some of the most vulnerable people in Fredericton, and they provide fantastic services for those folks that are most vulnerable. And there's a constant discussion and battle around funding for that. And so they approached us and said, if we can get our own EMR data, everyone that comes in, we see them, we have lots of good data about them. If we can link that to other health records, then we can make a case to government for funding to support the work that we know we're doing really well. And when we started working with Horizon, the health authority under which this clinic falls, they said, oh, there's their own EMR. They have their own electronic medical record. It's owned by another vendor. The vendor says it's too hard or it's too expensive. We can't help you. And this is not for us. We're just trying to help facilitate. Right. It's the system itself that is being hampered by this inaccessibility of data, or data that might be in theory accessible, but that are a mess or not usable.
It's so interesting because to me, the analogy is like preventative healthcare. If you can do things to prevent people getting sick, it's much less costly to the system. There was a great paper on alcohol use for anyone who was at it yesterday or had drinks last night and is regretting it. But the preventative way, so I guess RDM, especially if you started early in the cycle, is analogous to preventative healthcare, preventative data care, maybe we could call it. That could be a new way of looking at it. I wanted to open it up to the audience pretty soon. Was there any last comments that the panel wanted to make on this topic of costs.
Yeah,
Go ahead, Kevin.
I think one quickly is just the idea of reducing research redundancy, right? Like I'm working with people who are working in healthcare areas where people are exposed to certain treatments, also thinking of animal health and euthanasia associated with animal research. And I'm working with individual faculty who are saying, I don't want to have this happen to more animals if I don't have to. I'd like to make this data available so that they can actually access it and use it and inform it rather than running this experiment over again. If we think about systematic review research, for example, protocols are published beforehand. You can actually get a sense of what's out there and how it's being done and what data is being collected before that process even begins. So I think, to me, that's another huge risk of not making restricted data fair, is that people may be subject to treatments and experiments where they might not necessarily have to.
Okay, so it's fundamental to the whole point of research, was just to get the results out and usable. Thanks, Alex.
I was just going to say very quickly, yesterday, the panel was talking about the value of research to Canadians. And this data that's not available, that's restricted, the loss of that value, of that money that was given to a researcher. I've, being in RDM and people ask me what I do, and I explain to them and they're like, oh yeah, so researchers get money for that? Like, how much money do they get? Why is the government giving them money for that? Well, those questions are being asked because the research isn't coming out. And there's such amazing research out there that can't be made available because they weren't thinking about this. And now we're trying to rescue it. Sorry, I'm going to talk about it anyway before you ask me.
Yeah.
We're trying to rescue it and make it available, but we can't because they've sent us data sets with identifying information, but no documentation for us to be able to make it available. And so there's all sorts in health, but not just in health. So I think that's one of the big things with not having access to, or not necessarily access to the data, but information about the research, is the loss of value to Canadians. And why is this money being given to researchers to do these, what seem like really strange studies or weird things that researchers do?
Yeah,
I don't mean
okay.
weird in a bad way.
Thanks. I think we have a little bit of time for questions, and there are microphones here. So if you have something that you want to ask, if you could make your way over there, that would be great. And while people are doing that, you wanted something first, James, and then Ted.
Very
Yeah.
quickly, I just want to say, don't ever underestimate the value or the potential value of your data. That's one of the things I talk to, especially with graduate students. And I've worked with a lot of folks doing very niche research. I use the word data very liberally. It's all things. And I work with folks doing qualitative research, arts-based research, all sorts. It's one of the things I love about being central in the library, getting cross-discipline. Think about your area of niche research, if that applies. Think about the data that you wish you had from 50 years ago that you don't have, and how that would affect your research today. And that kind of springboards off Kevin's comments. Pay it forward. Think about what your data is going to potentially be. And what you see, the value of your data today may evolve and change, and it could exponentially so in 50 years, depending upon the world around it, right? So thinking about it like that, do the things that can help make it flexible so that it can survive and be there long after we go to dust. The data's there. There's a legacy. You're still contributing, to the research that I imagine you're very passionate and are giving your blood, sweat, and tears, and probably more your
Okay.
time.
Thank you.
The
Yeah.
data is there, but can be used. You need the but can be used.
That can be used. Well, that's the crux. Okay, Veronique, go ahead. If you want to introduce yourself before you.
Yeah, sure. Hi, I'm Véronique Dupéry. I'm the incoming academic director of the Quebec RDC network. So thank you very much for your presentations. It was very insightful and useful for me. But today I'm more coming as my question comes from my perspective as an individual researcher more than a RDC person. So like 12, 15 years ago, I started a longitudinal data collection in my lab. And at the time, as a, young professor starting my career, I sure wasn't thinking about FAIR principles at all. And now this longitudinal data collection has been going on for 15 years. And I have a lot of, a pile of data. And I feel that, I'm not able to use it as as much as I should, and I feel, and I feel a responsibility for that. But at the same time, like hearing you, I know that I should be preparing, metadata information about the data, but at the same time, it's so daunting. And hearing you, Alex, I mean, like I don't have the resources or the staff in my lab to do it. And, I receive funds from SHRC, and often the amounts are not necessarily huge for, doing that kind of work. So I'm wondering whether there are, new funding opportunities specifically for that. Like, could we apply to get funding to, document the data that we have in our labs? And if you're looking for a case study, Kevin, yeah.
I would love to say yes, there are funding opportunities to go back and make that kind of. I don't know. I'm not that far into sort of the funding world. I know the RDM group in the Digital Research Alliance of Canada, where we really want that to be in SHRC grants and CIHR and that kind of thing. One of the things and this isn't necessarily going to help your direct issue, but you can in funding opportunity or funding grant applications, you can include in-kind support from the library or in-kind support from RDM. So at Queen's, we're currently, I think there's like 8 or 10 funding opportunities that we've been included with an in-kind support amount. And we meet with these researchers regularly to talk about what they're doing in terms of RDM and how they're doing and helping them with the various things. So that's one way when you're starting. Put that in-kind support, go talk to your library. Which university are you at?
I'm at the University of Montreal.
So you want to talk to Ev.
Yeah, right.
And they can help you write like RDM in-kind support sort of thing. But in terms of getting the back stuff out, I don't know of funding opportunities that would support that, but that's what you need is the money, and it's a great way for students to learn how to do RDM to go backwards. But if you can get that money, as I said earlier, there's a lot more money that needs to be given for people like me to help you guys and train you guys and people to just do the work. And you just have to suffer through doing the work.
Right. And I also think that probably these are great resources, but in fields like education, for instance, where people are not necessarily data oriented a great deal. And if you submit a grant and you put a lot of money for, support like that, people are going to be, oh, you should use your money to, collect data. So I think that review committee need to be trained about those issues as well. Because
well, it's not just students and researchers who need to be trained about RDM. It's the people providing the money that need to be trained about RDM. And that's where the in-kind support comes in, because it's like, it's useful. But that's also what we do. We really try to focus on faculties and departments that are not traditionally data. So political science, law, education, and talk about this so they have the understanding, so they can tell whoever needs to be told, you need to support this RDM stuff.
Thanks.
But there is always stuff that you can do.
I think Ted wanted to respond as well, and we have another person. We only have a few minutes, so I'm just going to keep it moving.
Yeah, the other thing, if there is anything, just to look at what the existing data research infrastructure in the province might be. So I don't know Quebec as well, but in New Brunswick, we have data specialists. So rather than everybody who has a longitudinal data set applying to SHRC or CIHR for funding to develop their own data management model, we get community data from the YMCA who deliver a program. We get data from the Children's New Brunswick Youth Orchestra. We're not the data experts in those particular subjects, but they know that if they give the data to us, we can work with them on data standards. It doesn't mean it's open data. It doesn't mean that anybody can ask for it. We have a data governance model that covers access, but we have it, and then we can make it available. So it's about avoiding, don't pay for duplication. if there is infrastructure that is set up to help to do this.
Well, thank you all, and thank you, Ted. I work with YMCA Quebec as well, and they have problems with data access, so maybe we can talk about this later on. Thank you. Thank you all. Yeah.
Thanks. I think just behind you, she was there first. No? You're second. Okay, whoever's next. Come on up.
Hi there. Thanks so much for that panel. Super interesting. My name is Natalie Frank. I'm the director of the research and innovation team at Housing Infrastructure Communities Canada. So one of those government partners. And I just wanted to pick up on a couple of things, especially in Ted's remarks. The two questions, I guess, hopefully quick ones. So the notion of being more efficient and how these data approaches can facilitate more efficiency in government at all levels. In our department, I'm not health, but we do deal with the complexities of multi-jurisdictional data issues, municipal, provincial, federal, and private in our sector. And I was just wondering if the Alliance, if yourselves, if you're familiar with research that's demonstrated the efficiency factor here, because you've talked about sort of how it could support and the notions of where you can get more funding to do this. And so I always think about what's the case and how are we making the case and what's the evidence for that. And I guess building on that, because I work with so many different layers of partners, different jurisdictions, that concept of retrofitting and how we're going back to try to leverage the data that exists in systems, knowing it wasn't designed this way at the outset. It's going to maybe sound like a crass question, but are you familiar with any strategies that partners can use to do that retrofitting more easily? Because it is complicated. It does take a lot of effort. We hear often that it's too much work to do it. It's too costly. It takes too much time. So are there good examples of retrofitting of data into systems that weren't designed that way to make them more usable? If you have good examples. Thank you very much.
Okay, just very, very quickly, the first question, I'm sure there's literature, I just can't think of anything offhand. In my experience, our government worries less about literature and more about demonstrating value to them for their own operations. And we have lots of examples of that. And in terms of doing this for yourself, I guess one of the things that Health Data Research Network Canada is doing, where each of our provinces is benefiting enormously, is that there's best practice across the country. There's ways of doing this that many jurisdictions have done, and we're just being the conduit back to our local organizations to say, here's a way to do it. Like, we don't have to start from scratch. And if we can do this in a way that is consistent with best practice in other places where they've already worked it all out, let's just learn from them. And so part of this network is this sharing. And so our provincial government is benefiting enormously as we try and work with them to improve data, to say, if you're going to do it anyway, here's a way to do it. And here's a way to do it that makes it consistent across provinces. So when we answer those questions that you have asked us, how are we doing relative to PEI, we can do it.
Thanks. We have one more question and that's all we have time for. But I just want to say, you should ask yourself the question, are you ready for your systems to work well going forward? I'd focus on that first before the retrofitting personally. But anyway, last question. Thank you.
Hi, I'll be very quick. My name is Suzanne Ward. I'm Deputy Director for Policy and International at SHRC. And we've been involved with the other agencies in developing the tri-agency RDM policy that was referenced by the panelists today. But just on the question of funding and funding for, so to your question about funding for doing all of the tough work, and we know it's a lot of work. So I'll just sort of reiterate that it is a valid eligible cost of research in your grant, in your SHRC grant. So that doesn't mean there's more money to do it, which is, I think, is the point. But it is recognized as a valid use of your research funds. Just want to make a plug for another funding opportunity within our Connection Grants funding opportunity. We have a special stream for research data management capacity building. Again, it won't answer your needs, I don't think, because it's not meant for an individual project. It's meant to help the community grow its capacity collectively for doing research data management. And a lot of the librarian community, we've looking at who's been accessing those funds. The librarian community, not surprisingly, is organized and has accessed those funds. But what we're seeing not accessing those funds is sort of scholarly communities, the researchers themselves who are trying to figure out, well, what is the standards that we're going to hold ourselves to in a DMP? And I'd like to say that I was just looking at the recent intake. It's undersubscribed. There's room for more room for more grants within that program. So I'll just leave that with you, and I'm happy to answer questions throughout the day if you want to find me.
Thank you, Suzanne. That's perfect. I was thinking, if only there were a funder in the room to answer this question. And there we go. So we have to wrap up.
Thank you actually to SSHRC, because this panel is part of a SSHRC Connection grant that CRDCN received, as Natalie noted at the outset, to launch the Opening Doors to Data project that we will carry on for the rest of this year. But so I will thank you, and you will thank